There is no doubt that we need health care reform in this country, but Obamacare does not address the primary problems, and it is destined to increase costs and reduce access to health care. Even before Obama's inauguration, multiple non-political experts identified approximately 10 factors which contribute to the rising health care cost. Most of these factors contribute only a small percentage to the overall increase. Thus, the best health care reform is achieved if each of these market forces are evaluated and modified where appropriate. Some contributors to rising costs may be justifiable. For example, the costs for medications and medical devices are several-fold more expensive in the U.S. than in other countries. But these innovations appear first in the U.S. because these firms can invest, develop, and sell their products in a free market. Just with consumer products, such as computers and iPhones, the introductory versions are priced higher so that the companies can recover their investment costs. Obamacare deliberately added a tax on medical devices, which will eventually hinder new product development in this country. In the long run, this tax is a bad idea. There are, however, two significant contributors to rising health care costs which Obamacare neglected. The first is consumer pressure on physicians, and the second is consumer pressure on insurance companies. Until these two are addressed, neither Obamacare nor any other health care package will curtail the rising costs of health care in this country. In short, any health care insurance reform must model health care insurance after homeowners insurance. No one buys insurance to have the grass mowed or the windows washed. However, most homeowners buy insurance for the unexpected, such as a hailstorm that destroys a roof or a fire that consumes the house. One either does the routine maintenance himself or pays another person to do it. Generally, one gets involved in the maintenance and shops for the best prices. Likewise, one shops for the best home insurance to cover the cost of the unexpected disasters. Now that you have the picture, let's look at health insurance. For a variety of reasons, people believe today that health insurance should pay for the expected, such as mowing the grass, and that they do not need to be personally involved in their health care decisions. This is detrimental for a variety of reasons. There are multiple medical articles that confirm that the patient's participation is critical to achieve success in treating a variety of medical conditions. As one example, the physician can write a prescription, but the patient must be diligent to take the medicine. Secondly, since someone else is paying to mow the grass, neither the patient nor the physician have an incentive not to mow the grass when it doesn't need it. As long as the patient does not have some market incentive to question while the doctor is mowing his grass, Obamacare and any other reform will continue to escalate. The second major factor is the monopolies that the insurance companies have within certain market areas. Because the laws prevent the insurance companies from competing across state lines, they can continue to raise insurance premiums and continue to pay doctors to mow the grass that does not need it. This is an easy fix. The insurance companies must be deregulated so that they can compete nationally, thus giving health insurance purchasers more market options. The grass mowing problem is a bit harder to fix, but it basically requires the reimbursement model for primary care physicians to be changed. The American Academy of Family Physicians has proposed the patient-centered home model. In short, a physician group is paid a monthly subscription fee to provide unlimited care for primary care problems. Both the employer and the member pay a portion of the monthly subscription fee. Thus, the member has the incentive to shop for the best patient-centered home. The physician groups accomplish nothing by mowing the grass more than it needs it. In short, healthcare costs are reduced and patient receives better health care because he is an active payer and participant in the process. Obamacare totally ignored both the grass mowing problem and the insurance company monopolies, but rather took a failing Medicare, or what we call fee-for-service model, grass mowing model, and made it worse. The patient has little freedom or participation in his health care, and the physician is limited or restricted in the services he can provide. But rest assured, the physician will either not mow the grass because he is not being paid enough to cover his expenses, or he will mow it incessantly to make a living. Either the member has no coverage or he is frustrated with unnecessary visits or inappropriate tests. It's not bad for a crummy solution.